Alrighty, well, good afternoon, everyone, and welcome to this informational webinar on pre-retirement, hosted by U.S. Senator Bob Casey's office and the Social Security Administration. We're grateful for everyone taking the time to join this call today. I want to start by introducing myself and the other panelists on this call. My name is Andrea Guscott, and I am one of Senator Bob Casey's constituent advocates. Also on this call from Senator Casey's office is constituent advocate Maria Hernandez. And from Social Security Administration, we're excited to introduce Jessica Sylvant, who is Social Security's Public Affairs Specialist. We're grateful for her willingness to join our office for today's webinar. Before we get started, we'll quickly note that if you have any questions, please hold them until the end of the presentations, when we will have a Q&A session. We ask that you please keep your questions general and applicable to as many people as possible since this is a public call. If you have questions regarding your own specific situation, contact information for Senator Casey's office will be provided during the presentation for you to reach out to directly. And at this time, I'm going to turn the call over to Jessica with Social Security to delve more into the specifics.
Thank you so much, Andrea, and good afternoon, everyone. As Andrea mentioned, my name is Jessie Sylvant, and I'm a Public Affairs Specialist with the Social Security Administration. I've been with the agency for 14 years, and I've held many different positions, beginning as a claims specialist for many years before becoming a supervisor in the Philadelphia downtown field office. And I most recently began working as a public affairs specialist, where I've been here for just shy of a year now in this role. And I want to thank everyone for joining today's call, where we will be covering many benefit programs that Social Security offers to the public, including retirement, spouse, and survivor benefits, as well as a brief overview of our disability program and Medicare. So we can go ahead and get started. To the next slide. And one more slide, I'm sorry. Wonderful, okay. So in addition to our benefit programs, we will also discuss your work and how paying into Social Security tax helps you become insured for benefits. We'll also discuss taking your benefits, when is the best time, when is the earliest you can file, the reduction that comes with taking your benefits early, and the advantages as well. And additionally, we'll talk about working while receiving your benefits and how much you can earn if you're still employed when you begin to collect. We'll also talk about family benefits, including benefits that are payable to a spouse, a minor child, or a survivor. And finally, Medicare, which is a federal health insurance program, and what role Social Security plays in helping you enroll when you become eligible for coverage. Okay, so we can go ahead and get started. Move to the next slide. Thank you. Kind of an interesting and eye-opening fact that I'd like to begin with is how many people are estimated to have paid into Social Security last year. Of those 182 million workers, about 94% are covered by Social Security, meaning they've paid enough credits into the program to be insured to one day receive a benefit. And currently, more than 1 in every 6 people in the U.S. receive a Social Security benefit, with the majority of our beneficiaries receiving retirement. Now, this year, we expect roughly 63 million people in the U.S. will receive a retirement benefit. So this just shows how far-reaching our programs are for millions of Americans. Next slide, please. Now, Social Security has 4 main programs that are funded by the Retirement Survivor Health Insurance Trust Fund. The first, of course, being retirement, which is a monthly benefit payable to individuals who are a minimum age of 62 and have enough quarters paid into Social Security to be insured. Secondly, we pay survivor benefits to individuals who have been predeceased by a spouse, or could be a minor child who had a parent who worked enough in their lifetime to qualify for benefits. Additionally, we have a disability program for individuals who have a physical or mental impairment. They expect to prevent them from working for 12 months or longer, so it is considered more of a long-term disability program. And you'll see the SSDI and SSI in parentheses. We we have two disability programs. The SSDI program is based on your work and earnings, where your monthly payment is derived from your recent earnings history. And the SSI disability program is more of a federal welfare program for disabled individuals who have limited incoming resources, and there's no work requirement for this program. And then finally, there's Medicare, which is a federal health insurance program. And through Social Security, you can enroll for Part A and B. And I will discuss the various enrollment periods and eligibility factors just momentarily. Next slide, please. Now, most employers collect a federal payroll tax known as FICA, stands for Federal Insurance Contributions Act, and your earnings are reported electronically. FICA taxes fund the Social Security Retirement Survivor, Disability, and Medicare Trust Fund, and you likely see these taxes on your paycheck shown as either FICA, OASDI, or Social Security. And this tax is collected from both employees and employers to fund Social Security and Medicare, with a total FICA tax being 15.3% of your gross wages. And you and your employer split that down the middle and each pay 7.65% for FICA, 6.2% of which is allotted for Social Security and 1.45% for Medicare. Next slide, please. So how much work do you need to qualify for retirement benefits? When you work and pay into the FICA tax, you earn credits. So this year, in 2023, 1/4 of coverage or credit is $1,640 in earnings. And you can earn up to a maximum of 4 credits per year, and you must have at least 40 credits, which comes out to be a minimum of 10 years of work to be insured for retirement benefits. So the minimum an individual could earn and still receive the maximum of 4 credits earned for this year is $6,560. Now, of course, the more money you earn, the more FICA tax you pay, and as a result, the higher your monthly benefit will be. And additionally, there is an age requirement. You have to be a minimum age of 62 to be eligible, and you have to be 62 throughout the entire month to be eligible. So let's say someone's turning 62 today, June 22nd, they would actually have to wait until July to file for their benefit because they have to be 62 throughout the entire month to be eligible. Next slide, please. Now, Social Security uses a very complex formula in determining your benefit amount. However, I'm going to simplify it for you today into 3 basic steps. So step 1 is we adjust your wages for changes in wage levels over time. So essentially, we look at what you earned years ago. So whether you began working in the 70s, 80s, or 90s, we index those earnings for inflation and adjust them for what they would be in today's dollar. Then next, we find the monthly average of your 35 highest years of earnings. Don't worry if you don't have 35 years, as long as you meet the 10-year work requirement, you will be eligible for a benefit. However, we may have to use years of 0 earnings when calculating your amount if you fall short of 35. And then finally, we take that result to find your average indexed monthly earnings, which is really just a fancy term for your benefit amount and what you will receive for your retirement benefit. Next slide, please. One of the most frequently asked questions I receive is, when is the best time to start receiving my retirement benefits? And this is a very personal decision. There's no right or wrong answer, as it depends on your circumstances and everyone's situation varies. But as you can see on this chart, the longer you wait to file, the higher the benefit you receive. Now, this example is based on a $1,000 monthly benefit amount at the person's full retirement age, which is the age you receive an unreduced benefit, and what the varying amounts would be if the individual were to elect as early as possible at 62. You can see the reduction there would be, a reduction to $750 per month versus $1,000, and versus deferring all the way to age 70. Which is another filing option that I will also discuss in greater detail as we go along here. Next slide, please. Now, your full retirement age, or FRA, as we commonly refer to it, and I will refer to it through the duration of today's presentation, is the age when you receive your full unreduced Social Security benefit amount. And that age is determined by your year of birth. So as the years progress and people have been trending to live longer lives, the full retirement age has also slowly risen in conjunction with that. For anyone on this call today who was born in 1960 or later, your FRA is age 67. Now, if you elect to receive a reduced benefit prior to your FRA, you can see what the percentage of the reduction would be. So if your FRA is 67 and you elect a benefit at 62, you're going to be looking at a 30% reduction. So your benefit would be taken from $1,000 down to $700. Next slide, please. And this is just an example of what a reduced benefit would look like in comparison to waiting until FRA. In this case, we're looking at a 30% reduction because this person's FRA is age 67. So you could see a reduction of 30% or $750, reduced from the benefit amount if they were to elect it at 62 versus waiting until 67. Next slide, please. Now, when you elect to receive retirement benefits prior to your FRA, you are subject to an earnings limit. So for people who are under their full retirement age, it is a yearly limit of $21,240, and we look at the calendar year, January to December. So if you wish to file for benefits and you're still working, we will ask you during the course of the application what you anticipate to earn for the year, because if you exceed that $21,240 limit, Social Security withholds $1 back for every $2 over that limit you go. And our goal is to withhold that money up front just to prevent any kind of an overpayment from occurring down the road. Now, for people who want to file in the year that they reached their full retirement age, but they haven't yet hit that month of their birthday, that limit increases greatly. So they can earn up to $56,520. And if they should earn over that figure, we withhold $1 back for every $3 over that limit they earn. So, for example, let's say someone is reaching their FRA in September of this year, but they don't want to wait until September. They want to take their benefit now effective with June. We will only look at the first 8 months of their earnings. We're only looking January to August, and in those 8 months, they can earn up to $56,520 and still receive their benefit. We won't penalize them for continuing to work. We won't withhold anything back as long as they're under that limit for the first 8 months. And then once someone reaches the month of their FRA, from that point going forward, there's no cap or limit to their earnings. So, you can earn millions of dollars and we will not withhold any benefits back from you. Next slide, please. There's also an alternative earnings limit that you can apply under called the monthly earnings test, where we consider your work on a monthly basis if it's more advantageous for you. And this provision generally applies to people who have worked either a portion of the year and they stop midway or towards the end of the year. So if you exceed the annual earnings limit but don't plan to return to work for the remainder of the year, you can apply under the monthly rule, where you can receive your retirement benefit as long as you're earning less than $1,770 per month. Now, if you're filing under the monthly rule in the year that you reach your full retirement age, you can earn up to $4,710. I do have an example of this. If you could go to the next slide, please. So we have Bob, who's 63 years old, and he earned $70,000 between January through October. He's planning to retire on November 1st. Now, he can file for his benefits and receive his full amount for November and December as long as he doesn't return to work and earn over the $1,770 limit for the remainder of the year. So again, this is typically a provision that benefits people who have far exceeded the annual limit of $21,240, and maybe they have stopped working midway or towards the end of the year. Next slide, please. Now, another filing option that's available is to defer your retirement benefits past FRA and earn what are called delayed retirement credits. And retirement benefits are increased by a certain percentage for each month that you delay starting your benefit beyond your FRA, which comes out to be an 8% increase per year. The increase does stop after age 70, so there's no advantage to waiting beyond that point. And additionally, the increase of your benefit due to relate to delayed retirement credits is passed to any surviving spouse or child who may become eligible on your record down. Slide, please. And this is just an example of someone who has a FRA 67, again, using that $2,500 limit. If they were to defer 3 more years beyond their FRA, looking at that 8% increase each year on the $2,500, they'd be looking at a benefit of $3,100 or an overall increase of $600 per month by waiting those additional 3 years to file for their benefit. Next slide, please. Now, in certain situations, we can pay retroactive benefits, but generally only to individuals who are filing after their FRA, in which they can elect payments up to 6 months retroactively. So, for example, someone who reached their FRA last December, should they file for retirement benefits this month before the end of June, they could elect payments back to December, which is 6 months retroactive from their filing month of June. And that money would be paid to them in one big lump sum. However, someone who has not yet reached their FRA can only elect payments beginning with the month they contacted Social Security to either make an appointment or beginning the month they filed or started their application online. So we will protect you. Let's say you contact us today to get a phone appointment with your local office, but we don't actually have any available appointments until July. We will still protect you with the month of June because that's when you contacted us to express interest in filing. So if you are before your FRA and wish to file, we would still offer you the option, even though you're filing in July, of taking it back to June. Next slide, please. So a big question that we get very frequently is, when should I take my benefits? And as I mentioned earlier, this is a personal decision that comes with many factors to consider. A big one is longevity. Maybe you had parents or grandparents who lived into their 90s, and you may feel the odds are in your favor. You want to wait as long as possible for the highest benefit you can receive to sustain you for hopefully a very long and happy retirement. Other people may not be as fortunate, and maybe they don't have the best genes and choose to take their benefits as early as possible while they can really use it and enjoy it. Of course, none of us has a crystal ball for the right answer. But another major factor is your work plans. Maybe you enjoy working. How much longer do you plan to work? How much money are you earning? You might be able to continue working and still receive a portion of payments depending on your income. And remember, once you reach your FRA, even if you are still employed full-time, you can receive your Social Security benefits regardless of how much you're earning. Also, finances. Do you have enough savings and resources to live comfortably to sustain you through your retirement? Taxation is a big one. Some people are concerned about the tax implications of receiving their benefits, especially while they're still working. And excuse me, while obviously I don't work for the IRS, I'm not a tax expert, what I can tell you is that Social Security will send you a 1099 for tax filing purposes at the end of each year to show what you received in benefits. And additionally, you can voluntarily elect to have federal taxes withheld from your benefits by completing and submitting a W-4V form. Next slide, please. So payments are always made a month behind, and the rule behind that is that you have to live throughout the entire month to be eligible for the payments. That's why they're always paid a month behind. Now, for people who are born between the 1st and the 10th, they will receive their payment on the 2nd Wednesday of each month. Those born between the 11th and 20th will receive their payment the 3rd Wednesday of each month. And those who are born between the 21st and 31st will receive their benefit on the 4th Wednesday of each month. So they are staggered now. Many, many years ago, they used to all be paid on the 3rd of the month, but they have since staggered that just to make it not as overbearing for all of the banks to issue these payments out on the same day every month for millions of Americans. But that's a good thing to keep in mind if you have a date in mind that you want to have your benefits begin, just to be aware that they are paid a month behind. So if you're, contacting us to file for your benefits to begin July, you're not actually going to receive that until August, and then either the 2nd, 3rd, or 4th Wednesday of the month, depending on the day of the month you were born. Next slide, please. Okay, so there's several ways to apply for your benefits. The most efficient and easiest way, in my opinion, is to file by doing so online at our website, ssa.gov. Now, you do have to have a My Social Security account to file online. It's the optimal way to file because you can do it from the convenience of your home. You can do it at your own pace. You can start and stop the application as needed if you can't complete it all at once. However, if you do prefer to speak with a representative, you can call our toll-free number to make a telephone appointment with your local field office. The 800 number is open Monday through Friday from 7 a.m. to 7 p.m. And additionally, you can file up to 3 months in advance. So if you have a general idea of when you want your payments to begin, you have plenty of time to file ahead of that date. Next slide, please. Now, this is a screenshot of the homepage of our website and where you would go to access the online application, the big apply button right in the middle there. And you have the option of applying just for your benefits, Medicare only, or both if that's applicable to you. And to the left of that, you'll see the prepare section. That's where you can check your eligibility for benefits and access really a plethora of online calculators to help provide you with an accurate estimate of your future benefits. So there are a lot of great retirement planning tools available online that I'm going to touch upon in more detail in just a few minutes here. Next slide, please. So moving into family benefits, Social Security can pay benefits to certain spouses, divorced spouses, widows and widowers, which we refer to as survivor benefits, as well as minor and disabled children. And I'm going to touch upon each of these types of benefits in greater detail, as well as the eligibility factors that must be met to qualify for all these different types of benefits. Next slide, please. So to qualify for benefits as a spouse, the spouse must be at least 62 years of age, which you may recall is the same age requirement for retirement benefits. Additionally, the spouse and worker must have been married for at least 1 year, and spouse benefits are not payable until the worker starts collecting. So the worker must have filed for and currently receive retirement benefits in order for that spouse to be eligible. Benefits can also be payable to a spouse if they are caring for the worker's child and that child is either under the age of 16 or disabled. And in these circumstances, there's no age requirement for a spouse who has a child in care. Next slide, please. Now, requirements for a divorced spouse vary slightly. A divorced spouse must be a minimum age of 62. However, they had to have been married to the worker for at least 10 years. So the duration of marriage requirement is different from a married spouse who only has to be married to the worker for 1 year. Now, additionally, a divorced spouse cannot be remarried, and the worker must be at least 62 years old. However, another noted difference for a divorced spouse to qualify is that the worker does not have to be collecting their own benefits. So a divorced spouse can collect on a record should they meet the other requirements. Again, the worker does not have to be collecting their own retirement. Next slide, please. Now, for an individual who's eligible for both retirement benefits based on their earnings record as well as a spouse benefit, they have to file for their own retirement first prior to electing a spousal benefit. And the maximum that they can receive is 50% of the worker's benefit at FRA. So, for example, if the worker's benefit at FRA is $2,000, the spouse can only receive a maximum of 50% of that amount, which is $1,000. And additionally, the spouse's age determines the percentage of the benefit paid. So just as someone can elect reduced retirement benefits for filing prior to their FRA, a spouse can do the same thing, receiving approximately 30 to 35% of the benefit should they elect it as early as possible at age 62. Next slide, please. Now, there are some notable differences in the requirements and payment amounts for spouse benefits versus survivor benefits. Now, first, we discussed how a spouse has to be at least age 62 to be eligible. A survivor only has to be age 60 to file, and can file for disabled widow benefits as early as age 50 if they become disabled between the ages of 50 and 60. Next, you may notice a difference in the benefit amount a spouse can receive versus a survivor. Again, a spouse in a living situation can only get up to 50% of the worker's benefit at their FRA, but a surviving spouse can receive up to 71.5% of the worker's benefit, electing it at age 60, and they receive an increase for each month that they wait to file. Now, if a surviving spouse waits until their own FRA to file on their deceased spouse's record, they get 100% of the worker's benefit amount. Next slide, please. And here's an example. So unlike spouse rules, widows are not required to apply for their own retirement when filing for survivor benefits. So it kind of opens up more filing options for them. So as an example, we have Mary, who was widowed at 63. Now, Mary can take survivor benefits only and defer her retirement benefits. So she can elect that survivor benefit and let her retirement basically sit there and grow. Even if she wants to defer her benefit beyond her FRA, she can defer up to age 70 and get those delayed retirement credits and then switch over to her own retirement benefits once they're higher or once she chooses and decides that she wants to begin to elect them. Next slide, please. Now, in certain scenarios, Social Security is able to pay benefits to minor or disabled children. However, of course, there are a few requirements that must be met. First, that child has to have a parent who is either entitled to benefits due to disability or retirement, or is deceased, but that parent worked long enough and paid into Social Security to be eligible and insured for benefits. The child also has to be either under the age of 18, or if they're over 18 but still in high school, they can receive benefits as a full-time student up until age 19 if still in high school. And we also have a disabled child disability program. If a child is 18 or older, and they have a disability that began prior to age 22, they can apply for disability benefits under a parent's record and continue to receive those as long as they continue to meet the definition of disability under Social Security's rules. Next slide, please. So I'm going to switch gears now and move into Medicare. Medicare is a federal health insurance program, and Social Security assists you with enrollment for Part A and Part B. And this is just a sample of what the Medicare cards look like. Each individual is assigned a unique Medicare number, just kind of more for query and billing purposes. And your month of coverage is also indicated on your card once you are enrolled. Next slide, please. Now, there are two ways to qualify for Medicare. One is simply based on age 65 attainment, And the other is for disabled individuals who have either been entitled to Social Security disability for 24 months, or for individuals who suffer from kidney failure and receive dialysis, or due to or have had a kidney transplant. And in certain situations, if someone does not have enough quarters paid into Social Security to be insured for Medicare, can file under a spouse's record and use their spouse's quarters that are paid into Social Security to gain entitlement to Medicare coverage. Next slide, please. So to break down exactly what Part A and B cover, Part A is hospitalization coverage, and it covers 80% of costs incurred for inpatient visits and stays. Part A is premium-free for individuals who are insured for Social Security, so there's generally no monthly cost associated with it. Part B is medical insurance, which generally covers doctor's visits and outpatient hospital procedures. It also covers 80% of costs incurred for these services. However, it does come with a monthly base premium of $164.90. Some individuals who fall within higher income brackets are subject to paying additional premiums. However, that's determined on your tax filing status and adjusted gross income. But should you find yourself in this position, I highly recommend contacting your local Social Security field office, as in certain situations we can reduce or eliminate the premium if you have had a life-changing event. That could be a work stoppage, work reduction, marriage, divorce, or the loss of a spouse. Next slide, please. So there's 3 different enrollment periods for Medicare Part B. The initial enrollment period, it's a 7-month window that begins 3 months before your 65th birthday and ends 3 months after that birthday. There's also the special enrollment period for people who are 65 or older, but still working and covered under a group health plan based on either their own or their spouse's current work. And then finally, we have the general enrollment period, which is open from January 1st to March 31st of each year. Next slide, please. So beginning this year, the enrollment periods were streamlined in an effort to make the process easier and more straightforward. So for individuals enrolling in their initial enrollment period who opt to enroll 3 months ahead of their 65th birthday month, their Part B coverage will be effective the first day of the month they turn 65. Now, if you file in either the month you reach 65 or any of the following 3 months, the Part B is effective the month following the request. So if you turn 65 this month in June and you file in June, your Part B will be effective July 1st. Next slide, please. Enrollment for Part A is fairly straightforward. For individuals who already received Social Security, it's an automatic enrollment, so there's no action or application required. You will receive your Medicare card just ahead of your 65th birthday. It just is mailed out to you. Now, for people who have not yet filed for Social Security, an application is required, and that can be filed up to 3 months ahead of your 65th birthday. And the same filing options are available for Medicare enrollment as they are for retirement. You can file the application online at ssa.gov or contact the 800 number to make a phone appointment with your local field office. Next slide, please. Now, when enrolling for Part B, there are a few more factors to consider. If you're not working and not covered under an employer group health plan of your own or your spouse's at age 65, you will likely need to file in your initial enrollment period. And again, as the same with Part A, if you already received Social Security benefits, it's an automatic enrollment. For those who are not working and covered under an employer group health plan, you will likely file in your initial enrollment period. Next slide, please. So the initial enrollment period is a 7-month window. Again, it begins 3 months prior to age 65 attainment and ends 3 months after the month of age 65 attainment. And this year, as I previously mentioned, coverage begins the month after the request unless requested prior to age 65 attainment. So again, using the same example, if you are reaching age 65 this June, but you contacted us in April to file for Part B, your Part B would have been effective June 1st. So if you do it 3 months ahead of time, it's always going to be effective the first day of the month you turn 65. If you do it in the month of your birthday or those following 3 months, it'll be effective the following month of the request. Next slide, please. Should you miss your initial enrollment period, don't worry, all is not lost. You can file in the general enrollment period, which is open from January 1st to March 31st of each year, with Part B effective the month after you file. So should you decide to file in the general enrollment period, and let's say you contact your office in February to apply, your Part B will be effective March 1st, always effective the following month of your request. Now, penalties can apply in certain situations. If the initial enrollment period is missed, there is a 10% penalty assessed for every 12 months that someone should have had Part B coverage but did not. And that penalty is imposed for your lifetime. So it's very important to file in the correct enrollment period and know ahead of time which enrollment period is going to apply to you. Next slide. So for people who are still working at 65 and have an employer group health plan, they can generally delay filing for Part B as long as they remain actively employed. Now, once you or your spouse, if you are covered under a spouse's employer group health plan, should stop working, you then have an 8-month window to enroll for Part B without being penalized. And this is called a special enrollment period. Now, just something to note here, COBRA and retiree coverage is not considered an employer group health plan. Unfortunately, all too often, we see people who come into the office, who had maybe 5 years of health coverage that they were eligible for after they retired, and it was considered a retiree plan. We see it a lot with employees who worked for the city or the state. And they, are under the impression that that counts as employer group health plan, but they have to be actively still employed, not considered a retiree, for Social Security to consider it an active employer group health plan. So it's best to err on the side of caution if you're unsure. We always look at the earlier of the physical date of your retirement or the date you lost your health coverage. Whatever of those two events occurs first, you have 8 months from that date to file for Part B without being hit with any type of a penalty. And it's always best to contact your local office or the 800 number if you're not sure, just to be sure that you're going to qualify in that special enrollment period. Next slide, please. Now, we have a fairly new online enrollment option for people who wish to pick up Part B in a special enrollment period. And this option is available to people who have already enrolled for Part A, in which they can submit their Part B enrollment forms electronically on our website. And alternatively, you can also fax or mail the forms to your local field office, but it's a really easy place to go to obtain the forms, whether you plan to submit it online or mail or fax it into your office. Next slide. Now, Social Security has very minimal involvement with Parts C and D. However, I wanted to just kind of briefly touch upon the two parts to provide some general information. So Medicare Advantage, which is also known as Part C, is kind of an all-in-one alternative to original Medicare. Now, these bundled plans include Part A, B, and usually Part D, and they tend to have lower out-of-pocket costs and may offer extra benefits that original Medicare doesn't cover, like vision, dental, and other services. Part D is Medicare prescription drug coverage, which covers a major portion of your prescription drug costs. Now, your out-of-pocket costs, monthly premiums, annual deductible, and prescription co-payments will vary by plan, and you enroll with a Medicare-approved prescription drug provider, not by contacting Social Security. Now, each Medicare Advantage plan can charge different out-of-pocket costs they must follow rules established by Medicare. The Medicare-approved prescription drug plans cover a major portion of your prescription drug costs. And we do have an extra help program that's available for beneficiaries with limited income and resources that helps subsidize the premium and helps pay for the costs related to a Medicare prescription drug plan. So if that is something you think that you would be eligible for down the road, the extra help program is completed through Social Security, so you would want to contact us to apply for extra help. Next slide, please. I'd like to talk about some of our online services by beginning with My Social Security. My Social Security is a convenient and secure suite of services that are designed to help put you in control of your personal Social Security information, as well as help you manage your benefits when you start receiving them. And your account gives you the information that you need at your convenience without having to call or visit a local office. And this is a screenshot of the page that you would see when you're either creating or logging into your My SSA account. Next slide, please. One of the most beneficial features of having a My SSA account is the ability to obtain estimates of what your future benefit will be. And having a My SSA account draws directly from your earnings record. So it provides an individualized and extremely accurate estimate of what your retirement benefit will be at various ages. And you can get estimates as long as you have enough credits to be insured, you do not currently receive benefits or have a pending claim, or expect to receive a future pension based on work that was not covered under Social Security taxes, as this can sometimes cause an offset of your Social Security benefit. Next slide, please. We offer a variety of calculators to help you with your retirement planning. The retirement calculator is a great planning tool to obtain future estimates, but we also have a spouse calculator for those who may be eligible on the spouse's record. You can access the earnings test calculator to gain an idea of how many payments you'd be eligible for if you're still working while receiving benefits. So just a lot of great planning tools that are available for utilization with your My Social Security account. Next slide. And we also have a new redesigned Social Security statement that is accessible electronically through your My SSA account. And it's now written in plain language and has been designed to be easier to understand and to locate information. We now provide a graph with retirement benefit estimates for up to 9 different ages, depending on when you want benefits to start. And you can also see how much you paid into Social Security and Medicare taxes over your lifetime. It's very important to review your earnings statement to ensure it's accurate, because this is what your retirement benefit is based upon. So we, absolutely want to make sure that we have all of your years of earnings posted, and, for whatever reason, we're not missing any years. Next slide, please. Now, this is just a few steps on how to either open or sign into your My Social Security account. Our website with /my account is how you would get to the page that was a few slides back, where you would either sign in or create an account. Now, if you already have an account, it's very straightforward. You just sign in using your existing Social Security username and password. If you are creating a new account, you, of course, would want to select that button. And then you will be directed to a page called login.gov for the next steps, where you are prompted to create an account. After you complete the login.gov account, it directs you back to our website, where you want to provide personal information just so we can verify your identity. And then you'll be issued a activation code that helps you complete the registration process. Next slide, please. And these are just some of the benefits of having a My Social Security account. So for people who already receive benefits or have Medicare, they can request a replacement Social Security card, get a benefit verification letter as proof that they receive benefits. They can check their benefit and payment information as well as their earnings record, change their address, phone number, start or change direct deposit. They can request a replacement Medicare card, a replacement 1099. They can also opt out of mailed notices where they are just accessible electronically. Next slide, please. And then for those who don't yet receive benefits, still a lot of beneficial features to having a MySSA account. You, again, can view your retirement benefit estimates at different ages, view possible spouse benefits. You can also obtain a replacement Social Security card. You can check the status of your application or appeal if you have one pending. You can get a benefit verification letter as proof that you do not receive benefits, should you need that for any type of an organization. And also, as I mentioned, you can check your Social Security statement, where it's very important to do so just to make sure that we have your earnings record correctly and accurately posted. And you can see all the Medicare and Social Security taxes you paid and get very accurate and personalized estimates of your future benefit amounts. Next slide, please. And we also have a lot of different social media pages now. We're on Facebook, Twitter, Instagram, LinkedIn, and YouTube with the handle @SocialSecurity. I personally follow our Facebook and our Instagram account. I'm not on Twitter. I'm a little bit of a dinosaur in that respect, but we do share a lot of good updates and news about what's new in 2023 and updates should they, roll out through the course of the year. So it's another great way to be kept up to date with the latest happening in our agency. And next slide. I believe that concludes the presentation. And Andrea, I know that you had another session that you were going to do briefly before we went to the Q&A, so I don't want to step on your toes there. We want to hold questions for now.
Yeah, absolutely. We'll have questions at the end. But thank you so much for that information, Jessica. We really appreciate it. So now I'm going to provide an overview of how Senator Casey's office may be of assistance to constituents regarding Social Security issues and navigating federal agencies. Go ahead to the next slide. So Senator Casey's Office of Constituent Services consists of a team of constituent advocates who assist constituents who are experiencing issues with a federal agency. This includes, but is not limited to, Social Security benefits, missing passports, IRS problems, VA benefits, immigration snags, SBA concerns, and so much more. After receiving written permission, our office is able to follow up with a federal agency on a constituent's behalf to check on the status of pending claims or appeals, ask questions, relay information and concerns, as well as demonstrate Senator Casey's interest in the matter. Under the law and rules of the U.S. Senate, we cannot force a federal agency to act in someone's favor. And it is also important to note that if we cannot provide assistance, such as with a state or a private entity, we can refer constituents to someone who can best help. Go to the next slide. So with regard to Social Security, we can assist constituents navigate the different programs within the Social Security Administration, such as Social Security retirement, spousal and survivor benefits, Social Security disability, supplemental security income, and Medicare Parts A and B enrollment. The most common Social Security cases include Social Security disability appeals or back pay, replacement Social Security cards, questions regarding status of retirement claims, overpayments, and Medicare enrollment questions. Our office is also able to reach out to the Centers for Medicare and Medicaid Services, also known as CMS, when it comes to Medicare coverage issues, and Medicare Advantage, also known as Part C, and Medicare Part D prescription drug plan issues. Common casework within CMS includes issues with claims payments, coordination of benefits, Medicare as a secondary payer, issues with Medicare enrollment, and coverage of medical equipment, home health, hospital, and hospice care. Go ahead to the next slide. So if you would like to request assistance from Senator Casey's Office of Constituent Services, either with a Social Security question or for an issue with another federal agency, please do not hesitate to contact our office. You can reach us at the phone number 717-231-7540 or toll free at 866-461-9159. And you can also reach out via Senator Casey's website. So at this point, we will now open this portion of the presentation for questions for Social Security or for Senator Casey's office. If you have a question, you may click the raise hand button, which is at the bottom of the participants list, to indicate that you have a question. I will call on participants that have questions one by one and unmute you. Please note that this is a public call, so we ask that you please keep your questions general. If you have a specific issue, please feel free to contact us via the information on the previous screen. So again, if you have a question, feel free to use the little raise hand button. Okay. Well, if you think of a question, after this call, you can feel free to call our office, Senator Casey's office at 717-231-7540. And we'd be more than happy to answer your question or, get you in contact with Jessica if the question is for her. But I want to thank everyone for taking the time out of their day to join us. And I hope you all have a wonderful rest of your day.